The effects of the COVID-19 pandemic on the region of the Americas extend far beyond the lives lost to the disease. The care needs of most people in the region living with mental health and substance abuse conditions have remained unmet, especially those living in conditions of vulnerability, including historically discriminated populations such as Indigenous and Afro-descendant communities. PAHO's High-Level Commission on Mental Health and COVID-19 developed the new agenda for mental health in the Americas with 10 recommendations and strategy actions that are crafted for incorporation into countries' post-pandemic recovery strategies. 1. Elevate mental health at the national and supranational levels. Establish mental health as a national development priority, including mental health in universal health coverage, and develop strategic partnerships and alliances to advance and advocate for mental health at the national level and beyond. 2. Integrate mental health into all policies. Promotes the integration of mental health into all areas of health, as well as across sectors and in emergency and disaster responses. 3. Increase the quantity and improve the quality of financing for mental health. Outlines how to mobilize increased financing for mental health and allocate it more efficiently and equitably. 4. Ensure the human rights of people living with mental health conditions. Advocates for strengthening human rights for mental health through legislation and policy, transitioning services from psychiatric institutions to community-based care and capacity building in human rights across sectors. 5. Promote and protect mental health across the life course, including childhood and adolescence, adulthood, and older age. 6. Improve and expand community-based mental health services and care. Delineates actions to improve service coverage and quality by integrating mental health into primary health care, making services culturally competent, harnessing digital interventions, building capacity in mental health and psychosocial support, and empowering service users and their families. 7. Strengthen suicide prevention. Provides concrete guidance on evidence-based strategies to prevent suicide and its risk factors through the development of national suicide prevention strategies, public policy on means reduction and alcohol use, and capacity building to respond to self-harm and suicide. 8. Adopt a gender transformative approach to mental health. Lays out actions to reduce gender inequalities and address gender-based violence and harmful masculinities, key threats to mental health. 9. Address racism and racial discrimination as a key determinant of mental health. Emphasizes the need to combat systematic racism, targeting Indigenous peoples, people of African descent, and other ethnic groups by working with these communities to understand racism and its potential solutions, establishing national action plans against racism and racial discrimination, strengthening policy and legislation, and creating anti-racist environments. 10. Improve mental health data and research. Proposes actions to improve the availability and quality of mental health data through the expansion of mental health data collection, data disaggregation, strengthen monitoring and evaluation, and research in priority areas of mental health. Let's work together to create a world where mental health is the top priority.